Hi, this is Nancy, one of the Care Queens. This video is going to get into the nitty-gritty of changing an incontinent brief when a man has an erect penis. I had a caregiver ask me this question, and it's a good one. I must tell you that it's not often for a male client to have an erection if they're in the physical condition of needing bed-bound hospice incontinence care due to their overall debility and level of decline. However, we do unfortunately have young hospice patients at times, and I did used to work in both a spinal cord unit and in intensive care where there were many young men who had injuries requiring incontinence care. And despite their injuries, of course, they were younger and virile. So no matter what the patient's condition, we're going to talk about how to handle changing a male incontinence patient with an erect penis. Let's talk about it, and then I'm going to show you some more of my favorite techniques. First of all, stay calm and be professional. This is a very natural, and of course, it's an involuntary response. Be matter of fact. Do not demonstrate any kind of surprise or fear, and if you have time, just give it a moment. Often, the erection will subside on its own. You might even use some distraction by covering the penis with the brief, then engaging in some light conversation. Perhaps you go up and shift your care to adjusting a pillow behind his head, or you adjust the light in the room or something like that, just to give a little time. Often the patient, of course, is already feeling embarrassed and even ashamed, so remind them. Just be calm and remind them this is natural. Be reassuring, be calm, and then continue with your care. Do use minimal stimulation if possible when you're changing. Lift the penis very carefully to clean fully around it and under and around the scrotum. If the penis is flaccid, don't forget to pull down the foreskin if the patient has not been circumcised and clean the glands. If the patient is erect, do not pull down the foreskin. That will stimulate it further, and do fully avoid surrounding the penis with your hand and using a pulling motion that might be sensed as self-stimulation during masturbation. Gently pat on any skin protective product, and remember to apply very thin layers to avoid a buildup of any product. Remember to change and check your incontinent patients every 3 to 4 hours. Thoroughly clean and dry the skin. And here's one of my pro tips. If possible, leave the patient uncovered for 5 to 10 minutes to assure air circulation and dry skin. And I actually love using a hair dryer on very low setting, and then you can move the skin, get all dry and in around the cracks, especially if there's a wound or a rash. Be really careful. No matter what type of brief you're using, make sure it's the size that is large enough to cover the buttocks for stooling, but that it will reach all the way up to the waist. Okay, so if you only have a smaller size and the patient becomes erect every time you're changing them, make sure you position maybe less at the buttocks and more so it will fully cover the erect penis on the abdomen. Okay, so now you've completed cleaning and you're ready to actually put on the brief. I am assuming that you know how to get that tabbed brief under the patient. If you're not sure, watch our brief changing video. We go through it in detail. So the brief is under the patient and you're ready to bring it forward over the erect penis. In that case, always move the penis in the direction it is really wanting to move. And generally that's upwards towards the belly. Here are two options for dressing that patient, whether the patient is wearing a pull-up kind of dressing or a tabbed one. You may consider using one of the absorbent inserts that are now available. And you can see I put one inside a pull-up and I marked it with an X. And that would be over top of the penis, so it will give more absorption. And also in the tabbed brief, again, you can put that absorbent pad up a little higher so that it would actually cover up to the waist if the patient had the penis was up there. So a little more absorption. Okay, the final thing to do, which I think is very helpful, and most facilities have access to an ABD pad, And that would be to open your ABD pad, your absorbent pad. I'm going to use this tube to demonstrate as my penis. And you can put it over the top of the penis, over the urethra, and then wrap this around the penis as you then pull up the brief so that it is getting extra absorption right there at the top. I really appreciate the questions and the comments that you make. It really brings to our attention, Brenda and I, we're the Hospice Care Queens, what your needs are. So please visit our blog every day, watch our videos, send in your comments and questions. Remember to get our booklet, which has all of this information in it. And also, of course, always remember our motto, care is treatment.